It has been described as the Wild West by MPs because there's so little regulation. Doctor, at the moment, what's the situation? Let's say I, who read English literature at Cambridge about 100 years ago, suddenly think I fancy being the person that injects Botox into people's faces. What happens then?
This is a really great question. So you describe it as the Wild West. It is the Wild West. So in this hypothetical, say tomorrow you wanted to learn how to do it. We could find you a course online. You could be training, and then the day after you could open a clinic.
Literally?
Wow. Literally open a clinic.
And if I did that, I'm not breaking the law?
No, not at all.
And I do have biology O-level, but I have nothing else.
That is it.
So I could be let loose on Lizzie's face with a needle in my hand, and that's fine?
100%.
Wow.
And this is where it becomes, obviously that in itself is very scary.
Yeah.
You could then do another course where you could be, in theory, taught all the advanced techniques. And these things, when we say advanced, we mean increased risk.
Right.
You know, these are the things which carry significant risk of, not just blocking of blood vessels, but even blindness, these kind of things.
Wow.
Now, you could be doing that 2 days after you originally started, and you could also be describing yourself as an advanced practitioner.
Wow.
So to a layperson, somebody who doesn't know, that sounds very medical. This is where it becomes very, very murky, and there's a very dark side to aesthetics.
And just imagine I were to do that. Of course I'm not going to, but let's say I did set myself up. I did an online course, and then I was administering Botox and fillers. Where would I buy the product that I would be using to put into people's faces?
Yes, so that's a really good thing. From a perspective of getting filler, you can get it anywhere. And we're seeing a lot of products which are coming over from Southeast Asia, very cheap products. So very inexpensive products, and sometimes which you were not sure where it comes from and the quality.
Right.
We're seeing a lot of patients who are having reactions to those things because we can't, determine what is actually being used in those products. So that's a very scary thing. Now, from Botox is actually a prescription drug, which basically means it should only be accessed by doctors or prescribers. However, again, there are ways of people accessing this, typically online, especially from Southeast Asia, and they're getting knockoff Botox.
Wow. OK, now what we're going to show now, Doctor, and you'll be familiar with this because it's you doing it, is you getting some horrible bad filler out of somebody's lip. Now, I warn you, this is not pretty to look at, but I'm going to have a good look at this. What are you doing? Oh, my God, what is that?
Exactly. So there's not one for around the lip side. So this was a lovely young patient who'd been to a non-medical prescriber. She'd had some very inexpensive products. She didn't know what it was, where it came from. And she came to me about 3 weeks later, big lumps. And the practitioner who treated her had basically ghosted her. So had disappeared, wasn't answering any calls. Wow. So she asked for me for help. And that was me expressing what essentially was, I don't know what this product was, but it wasn't great. And then I had to then treat her to make sure she fully recovered.
Oh, my God. So people might have thought that was pus coming out of her lip, but it wasn't really, was it?
It wasn't. It was basically kind of a filler which hadn't integrated, probably because it was never going to, because it was very cheap.
Yeah.
And there was probably some element of bacteria and infection there as well.
Good
so
Lord.
Even if we had a non-medical practitioner who did try to treat that, they can't prescribe antibiotics. They won't be able to manage these things as well. So this is an extra level where people are not only doing things which they're not trained for, but they're also not able to manage anything which it goes wrong.
Goodness me. And I'd like to ask you something else so we get the real bottom line on this. So let's imagine that you go to some high street Botox person and you have either Botox or fillers or both, and they do go wrong. Yes. We all know they can go a bit wonky or droopy and that kind of a thing. But are there any really serious things that can happen? There are.
And we talk about, let's put this straight. In the right hands, these treatments are very safe in the right hands. In the wrong hands, using the wrong product, and on the wrong patient, they can have devastating consequences. The most serious things we think about, especially with fillers, patients can go blind.
Yep. Go blind?
Yes.
Why? How? How does that work?
So essentially, it's because of the complexity of the blood supply to the face. Now, again, this is another reason why training for years and years as a doctor or a nurse gives us that level of experience and knowledge. Yeah. But essentially, all the blood vessels in the face communicate, and they actually communicate with the blood vessel which comes straight from the eye. So if you are injecting and you don't know where you are, what you should be doing, in theory, the filler can travel all the way and cause blindness.
Ooh. Yeah.
Exactly. So that's one, but also we know last year there was a case, a very tragic case of a patient called Alice Webb, who also had filler injection in the backside with a Brazilian butt lift.
Yes.
And she tragically lost her life. Again, this was a non-medic prescriber, or non-medic practitioner, who shouldn't have been doing it, who wasn't qualified and wasn't able to manage the complication. And this patient lost her life.
I'm just confirming, they're not breaking the law in doing this?
As it stands at the moment, doing injectables, as a non-medic, they are not breaking the law.
Why is that the case? It's obviously common sense. It should be only medical professionals. Why has it not been put into law already?
100%. And this is why we're kind of, as doctors and nurses, we are banging our heads against the wall. We just feel like there's a common sense element which is just lacking here.
Okay, well, in a minute, I'm going to ask you, if you do want Botox or fillers, how and where should you access them? That's coming up. But first of all, on the line, we have Marcel in Dorset. Marcel, thank you so much for joining us. Tell me what went on with you, my love.
Well, I was thinking about Botox, but I wasn't actively looking at it. And I was on my Facebook page and an advert popped up for a local beauty salon doing Botox. So I thought, oh, I might book in for that. Well, I did, and it turned out I was actually going to someone's house, which was a pretty manky rented place. And the guy turned up, and I didn't see anything, that sent red flags. He was more expensive than anybody else, so I thought that was a good thing. And he came in with his silver box. Took the needle out, and I was trying not to look at the needles. And I said to myself, that looks like a dog vaccination needle. So I said, aren't you going to use those long, fine ones I've seen, in the magazines? No, he said, these are better. So I decided to have my jowls done. Well, I found out later that's not what Botox is for. So had those done, and he said, if it doesn't work, you can come back for a free top-up. Well, nothing happened other than a bit of bruising. So while I went back for the free top-up, I thought, well, I'll pay extra and have my brow done. Oh, then it all went horribly wrong. It was like being burnt.
The pictures here, Marcel. So on the left, that's your real face. And on the right, oh, my God.
See it, yeah.
Wow. So did you find out what caused all of that?
Well, yes, because it was a case law. The first time we actually managed, and the police were great, to get him prosecuted because he said he was a medic. Now, if other people do this and don't say they're a medic, there are no repercussions. And I ended up, yes, with full anaphylactic reaction in hospital. And during the court case, we found out it came from China and it was unpurified beef gelatin.
My goodness, I hope you're all right now, are you?
No, it's left me with permanent pain over my eyes, my sinuses, and my mouth is wonky. The muscles one side were damaged.
So sorry,
my mouth doesn't work. Everybody thought I'd had a stroke, but no, it was a learning curve. And of course, since then, I have learnt so much more about it, and there are so many fraudsters out there.
Marcel, thank you for telling us about it, being so honest about it. Let's bring Dr. Glyn into this. I mean, this is, a terrible story, isn't it? A poor thing.
My heart bleeds for Marcel. That's really, really
shocking.
Yeah, it's shocking, that is. And it kind of just speaks to what we talked about before. These are products which we don't know where they're coming from.
Beef gelatin.
I don't know, exactly. You have to remember that the reason that brands like Botox are expensive is because the toxin is the most powerful toxins in the world. So there's so much science that goes into making it safe. If we're getting it from an unknown source, we don't have that safety. It sounds like in Marcel's case, there was also another level of kind of darkness, I think, in terms of who the person was.
Pretended he was a
pretending
doctor.
They were a doctor.
But what about the needle that she recognised as a dog vaccination needle?
These are horror stories. But I've had my own awful experience, and I'm glad you brought it up because I went to someone. I was after a split actually. I wanted to have a quick fix and feel better.
Yeah.
And the filler nearly made me go blind. I started losing my eyesight. It travels. I don't think anyone tells you this, but fillers actually do migrate, and my eyesight started going blurry.
God.
And it was very, very frightening. And it really do your homework if you go to anyone. Make sure.
Right.
They're
So,
proper.
doctor, what should you do if you want to have Botox and fillers? And there's nothing wrong with having them if they're properly administered, is there? So, what should you do to make sure that the person is safe and is not illegal, but is not going to hurt you, basically?
Well, I think as kind of Marcel mentioned, the circumstances didn't seem right. She was going around to somebody's house. Now, you've got to remember, these are not beauty treatments. These are medical treatments. Now, if you're doing something in the back of a salon or in somebody's house, that's a bit of a red flag straight away. But also, don't be afraid of asking the person their qualifications. You know, we know that there's a lot of confusing terminology. For example, we talked in that your scenario, you could describe yourself as an aesthetic practitioner. Doesn't mean anything. This is the issue. And I've seen cases where people have done those courses over a weekend and they might have a background of working in a dental reception. The next thing you know, their Instagram profile is saying, oh, I've 10 years of medical experience. This is how kind of, you know, misleading.
So are you wanting them to say, I am a doctor?
We should be saying, I am a non-medic. That's the thing.
Oh, I'm a non-medic.
A non-medic injector. This is the thing. Using confusing terminology like an aesthetic practitioner, because if I'm saying I'm an aesthetic practitioner and I'm not a doctor, but I have 7 years of medical experience because I worked in the reception of a dental clinic.
Right.
Those things are not the same. So always, you know, and we have people who inquire from my team and ask, actually, is Dr. Glyn a fully qualified doctor?
Yeah.
I don't take it personally. We say, yes, of course.
Yes.
But we've seen cases where people have purchased PhDs online and then referring to themselves as doctors.
Wow.
So again, there's a huge amount of kind of, you know, things which can trip patients up, but huge red flags. Ask about the credentials. Ask about the products. You know, if you have anything which doesn't sit right, don't be afraid of walking away.
I know, but how do you know what sits right? You know, you arrive, you don't know what it's
wouldn't
supposed to
say-
look like or smell like or be
Exactly.
like.
I don't know anyone that would say, where is this Botox actually from? Is it from China?
And even if you got the answer, you wouldn't know what the right answer was, would you? How do you know if it's the kosher
This
one
is
or
very
the
true.
unkosher one?
100%. And I think we talked about kind of, you know, Botox parties. We talked
Yeah.
about as a really good example. They should not exist because as medics, as doctors and nurses, it's always about putting the patient's safety first. And part of that is me informing you about what could happen. Now, if you're under the influence of alcohol or you're surrounded by peers who are all having this done, you are not giving me free consent. You're being coerced. So these kind of situations, again, shouldn't be accepted. You should be avoiding those at all costs.
Is it also true that even if the practitioner is a doctor, a qualified doctor, it can still go wrong?
Yes, exactly. I always kind of say to my patients, you know, it doesn't matter how skilled or how experienced you are, nothing is 100% safe. And that is part of my process to explain this. So, you know, whenever we do an injection or whenever we do any treatment, there is that small risk that something can go wrong. However, I'm doing it knowing that I'm able to, in the vast majority of cases, deal with those complications. Right. When people either aren't told about those complications or they're being performed by somebody who can't manage it, that's when it becomes very ethically dodgy.
All right, well, we've got a message from Jack, and Jack says, yes, they should be banned. There are so many young people who do not need work done, but are getting it done anyway. This is increasing young people's insecurities and the need for perfection. And actually, I'd love to know what you think about that, because one of the kind of belief systems is that you should start having it long before you need it. In other words, when you are young and you haven't yet got wrinkles, because if you do, it'll be preventative. It'll stop you screwing up your face and it'll stop the wrinkles getting deeper and deeper. I don't know if A, that's true, B, you encourage that, or C, you think there is a kind of age, optimum age.
So I don't encourage it, because I feel that we can still look great with wrinkles. You know, we don't have to obliterate wrinkles. And actually, aging gracefully is a very natural thing. Now, we can age well and still have these treatments. If I have somebody who, say, is 18, 19, who doesn't need treatment, obviously I'd turn them down. You know, they don't need it done. It's different if somebody has something which maybe I see a lot of young patients who have very weak, deficient chins and they never had kind of a good profile. And that can really affect their confidence. In those circumstances, yes, I'll always listen to them.
Is that where you use a filler?
Yes, exactly. And I use them, you know, because these patients 20 years ago could only have surgery. Now we have some amazing technology which we're able to do injections and it can give them a huge confidence boost. But it's not beautification. That's, you know, what we try to avoid. It's not giving this cookie cutter approach. It's about trying to boost somebody's confidence. But the preventative starting treatments in the early 20s to prevent wrinkles, I'm not a believer in this. I don't think
question. You could be a doctor,
yes,
but you might not be a cosmetic doctor or an aesthetic doctor or a doctor that does plastic surgery. You might not be that kind of doctor. You might be an ear, nose and throat doctor. You might be an appendicitis doctor or an orthopaedic surgeon. True. Just because you're a doctor, does that mean you're going to be good at doing Botox and fillers or not?
No, and that's a really great question, because obviously there's a learning curve.
Glad you like the question.
I love the question.
I've been doing this for a long, long time. I'm glad you like the question. That's good.
It's because you're right. There's always that learning curve. It doesn't matter. If you're an orthopedic surgeon, you're very good at orthopedics, but you're still going to have that learning curve. The difference between if you're dealing with a doctor or a nurse who's starting that process, there is accountability. So they are, if for whatever reason they act in a way which is inappropriate or they do something which is dangerous, they have accountability. You can report them to their governing bodies, the GMC, the GDC, etc., and there will be some means of removing them from the system. So no, it doesn't guarantee that person's going to give you an amazing result. That's why we have to do research, but there's always that accountability.
And just finally, so obviously you are recommending that if you're going to get Botox or fillers, it should be from either a trained nurse, a proper NHS trained nurse. They might be in private practice now, but they were trained on the NHS and you know they're bona fide and good, or even better, a doctor, and even better, a surgeon. That would be the ultimate kind of
Either
ideal.
of those three, because you can check their credentials, you know there's accountability, and you also know they're not going to be ghosting you.
And where would you find them?
So there are different ways. Each of those different those specialties will have a regulatory body. So, for example, if you want to check a doctor's registration, you can look on the GMC website, dentistry is GDC website, or nursing is the NMC website.
And do you feel confident of dentists giving Botox? I mean, they're
do,
good at the
I
face
do.
and the jaw and everything like that. At least they know what they're doing.
I think this is a whole debate for a different time. But I think dentists. I've got some great colleagues who are great dentists, and they're very good at aesthetics.
Right.
Would it not be better just to not get Botox full stop then? It seems like there's other ways to, like, maybe we should be telling kids to wear sunblock when you're younger, other ways to prevent getting wrinkles if that's the goal. But having the Botox, there's still a risk regardless of who does it.
100%. And I think you're right, that preventative things, starting SPF very early is a very great way of preventing things, but we will always develop them. And, so Botox has been around for like the last 50 years. It's a very safe treatment. It shouldn't be spoilt by those kind of few odd people who are cowboys.
How do you stop these cowboys? How do you stop these Botox parties? How can you, doctor? Because sadly, many young girls that I know look at the celebrity magazines, say, "Oh, I want to look like that," and doctors are doing it, and then they're doing it for money,
And
not
also
for
there
the
becomes
care.
a sort of aesthetic that is almost obligatory. You've kind of got to look like that. And now we see it all over the place, particularly in very young girls, which is your face looks like a shiny egg.
Yes.
Completely smooth and with this peculiar sheen on it. That means, am I right? I'm not being nasty. It's just true, isn't it?
No, you're right. I think that has definitely been something we saw. Not in my patients, obviously, I want to make clear.
Yeah.
And this was this perspective that if you had it done, you had to look fake. And we know that's not the case.
Right.
When it's done well, if it's done appropriately, you can get some beautiful results which are completely natural.
Well,